My name is Lara Turner, and I'm a nurse practitioner student, and this is my advanced clinical assessment for 604 for Bradman University. For this assessment, prior to going in and seeing my patient, I would review their medical records for a medical history, surgical history, any known allergies, medications that they take on a regular basis, a review of their blood pressure, a review of systems or any previous medical issues, family history through 3 generations for medical issues, social history such as alcohol, drinking, or drug abuse, educational level, housing, and access to resources. And for this assessment, we would have obtained vital signs prior to that and also done a visual acuity with a Snellen's chart to check their optic nerve too. So we would have had part of that already done. I would make sure that our room was private, that we had enough light and equipment to do the procedure, and we hopefully wouldn't have anybody walk in on the middle of it. Good afternoon. My name is Lara Turner, and I'm a nurse practitioner, and I am going to be helping take care of you today. Can you tell me your name?
Sarah Singleton.
And can you tell me why you're here?
For a physical assessment.
Both of those things tell me that she's orientated to person, place, and thing, an event. So neurologically, she's intact on that part of her brain. I would look at her body posture. She has good posture. She has no apparent guarding. She's not using any accessory muscles. Her skin is within normal color for her ethnicity. She has no open wounds, no lesions, no edema, and we are going to get started. We're going to start with the scalp. I would visualize her hair. It has equal distribution. It's thick. It looks healthy. I don't see any deformities. I would put my hands and feel, look for any bald places, any scars, feel for any boggy places, any step-offs, any lesions, any point tenderness, anything at all?
No.
Anywhere along this exam, if anything is uncomfortable or hurts, please let me know and we'll change it so we can get the information without making you uncomfortable. Her scalp is intact, her hair is all nice and equally distributed, her face is symmetrical, she's got even brows, both of her eyes are equal distribution, her nose is midline, her nares are the same size, her lips meet, I don't see any facial droop. Can you lift your eyebrows for me? Good. Close your eyes real tight. Purse your lips. Puff out your cheeks. Good. And smile real wide. Good. All right. We're going to look at your eyes here. Upper and lower pupil. Okay, both of her lids are intact. There's no ulcerations. They're pink. There's no eye drainage. Her sclera white, her conjunctiva are pink. Her pupils are equal and midline with good focus. All right. We're going to do lights. She has a good red response in both eyes, which indicates that both of her retinas are functioning like they should be. All right. I want you to follow the pin. Good. We're checking for pupillary response. You check twice. Once for the pupil that you're putting line in and once for the pupil that's collateral to it to make sure that you have an equal response. Look at my nose. Pointing
1,
down here,
2,
up here,
1, 2.
Perfect. All right. Feel right here, frontal, sinuses, any pain?
No.
Ethmoid, sinuses, any pain?
No.
Maxillary sinuses, any pain?
No.
Feeling for occipital lymph nodes, posterior cranial lymph nodes, anterior, tonsil, submandibular, suprafollicular. I don't feel any lymph node enlarged, but her thyroid is midline. I don't feel border or any lymph nodes. Good. Open your mouth for me real wide. Good. All right. Tongue down. Perfect. Okay. She has good dentation, no open ulcerations. Her mucous membranes are intact. Her uvula is midline. Her tonsils are not enlarged. In this case, she doesn't have them, so there wouldn't be. All right. Let me get the light on. All right, we're going to look at your nose. It's straight midline. Her septum from the outside is midline. Her nares are equal. Visualizing inside. Okay. Her mucous membranes in her nose are pink. There's no erythema. Her lower and mid turbines are intact. And no redness or irritation there. Okay. Close your eyes. How do you smell?
Peppermint.
Okay. Cover the other hand. There you go. How do you smell?
Peppermint.
Perfect. We're checking olfactory sense of smell. Then let's look at your ears. External ears intact. Your peenie is intact. There's no erythema. There's no drainage. There's no redness. If you look at them, they're symmetrical from each side. Her TMs are pearly gray with a good cone of light on the right side. TM is intact with a good cone of light on the left side. There's no drainage in either.
Yes.
Sorry. Okay. All right. We're going to do a Rayner and Warner test for hearing and bone conduction. Okay?
Okay.
You hear it equally on both sides?
Yes.
Okay. I'm going to do the right ear. Tell me when you quit hearing it.
Okay.
Tell me when you quit hearing it.
Okay.
All right. When you quit hearing it.
Okay.
Tell me when you quit hearing it.
Okay.
All right. Good. And you're hearing it 2 times induction, which is good. Let's do this. All right. Let me borrow your. Doing deep tendon reflexes. This one. Mhm. Let me have me. Okay. Perfect. Okay. All right. First, open your jaw for me. Any pain with that?
No.
Looking for TMJ. I want you to close your eyes. I'm going to do touch sharp, dull, or soft. Tell me what you feel.
Dull. Sharp. Soft. Dull. Sharp. Soft. Soft. Sharp. Dull. Soft. Sharp. Dull. Soft. Sharp. Dull. Soft. Sharp. Dull. Soft. Dull. Sharp. Soft. Soft. Dull.
Sharp. You're supposed to sound more convinced. Okay. Big up.
Dull. Soft. Dull. Sharp. Sharp. Dull. Soft.
Perfect.
conviction. Say with conviction.
Okay.
Don't for sure.
Okay. Just gonna feel your carotid. Good. +2. Okay. Listening for bruit. No bruit or thrill. Listening to your heart, aorta. Pulmonic. Herbs point. Tricuspid. Mitral valve. Okay. Nice deep breath. Good. Again. 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 Good. One more time. Right. I come on the back. All right. Feeling your thyroid here. Nice swallow for me. Shrug your shoulders. Lean forward for me. Any pain at all?
No.
Okay. All right. Sit up for me. Name 99.
99.
Again.
99.
Again.
99.
Perfect. Nice deep breath. Good. Okay. Deep breath for me. Let it all out. Equal chest expansion. She has diaphragm movement of less than 4 centimeters on both sides, which is equal. Her spine is midline. She has no deviations to it. She has good chest expansion. And let's listen to your lungs. And no increased or decreased tactile fremitus. Deep breath. Again. Good. Again. Good. Again. Good. Again. Perfect. Again. Good. Again. Good. Again. Good. Again. Good. Again. Pain?
No. No.
All right. Hands up like this. Good. And push against you. Resist. Pull against you. Perfect. Squeeze my finger. Good. Just gonna move your arm. Any pain at all?
No.
Okay.
No.
I need you to. Okay. I need you to touch your nose and touch your finger. Other side. Okay. I need you to scoot back just a little bit. Lift this leg. that leg. Good. Okay. Push up the feet. Good. Push down the feet. Perfect. No pedal edema. Good post-tibial pulses. Good pedal pulses. Cap refill less than 2 seconds. Cap refill upper body is less than 2 seconds. Also, skin is warm and dry. Her turgor is adequate. Her nail beds are all equal. There's no striations, no deviation, no finger clubbing. Okay. Lift this leg against me again. All right. And if you'll stand up for me. All right. I need you to lean back as far as you can. Good. Good. That's perfect. Lean forward all the way down like you're going to touch your toes. Perfect. To the left side. To the right side. Any pain with that?
No.
Okay. Tip your head back all the way. Bring your head down to your chin. Perfect. Head left. Good. Another. Perfect. Wonderful. All right. Walk forward like you normally would walk. And walk back towards me. Heel, toe, the drunk thing. The drunk test. Perfect. Walk back that direction on your heels. And back towards me on your tippy toes. Perfect. And can you squat for me? Perfect. All right. I want you to put your arms straight out in front of you and close your eyes for me. Perfect. That's round bird sign. It's negative. That's good. Your cellar bone loves you. Go lay down. Thank you, ma'am. Okay. We're going to visualize your abdomen. It's symmetrical. It's equal. There's no striations. There's no bruising. There's no herniation. There's no obvious gross deformities. We're going to start out listening for bruit, aortic bruit. There is an iliac. Renal. Femoral. Equal bowel sounds bilaterally. +2 femoral pulses. +2 popliteal pulses. +2 posttibial pulses. A negative Babinski sign. The pressure. Anything?
No.
Feeling for your right kidney. And for your left kidney. Her liver is less than 1 centimeter under the sternal border. Her aorta is lateral to the umbilicus left side, less than 2 centimeters. I didn't feel any masses, any palpitations. I didn't feel her kidneys. All right. you lift this leg straight up for me? Perfect. Back down. And I'm going to bring this leg up. Any pain? Testing her psoas and her orbiter. That's to rule out appendicitis. Okay. I'm going to lift this knee. Okay. Okay. Any pain with that at all? Pull. Any pain with that at all? Valgus and vagus, checking for tin pain, and checking drawer sign. All of that's negative. Okay. Just flexing your toes. Oh, okay. I'm going to get you to scoot up. Well, let's scoot you over first. Let's check your shoulder last thing. Okay. Wait, if there's any discomfort. Okay. I'm going to do the other side. Okay. Towards me. Good. Anything? Yeah. All right. Let's get you up at a 25 degree there. Okay. Looking for JVD. She has no JVD. It's less than 3 centimeters above the clavicular at a 45 degree angle. So that's good. Okay, let's have you stand up. I want you to take your right arm and put it straight out. And bring it down slowly. Left arm straight out and bring it down slowly. Okay. We're going to put both arms out, put your thumbs down. Turn them up. Any pain with that? No. Okay, we're going to do that scratch test. Right arm up between your shoulder blades. Good. Now underneath. Good. Other side. Perfect. Down. Good. Yeah. Does that hurt at all? No. All right. Let me borrow your wrist. Any pain with this? No. Any pain with that? No. Perfect. Have a seat for me real quick. One more thing. Just gonna put my hand here. Lean forward. Good. Perfect. PMI. Set your 7th intercostal space and collect your line exactly where it's supposed to be. No deviation there, so no enlarged heart with that. And that should be everything.